Hello, hello, hello. It's Claudia Mühlenbeck here with Clear Vision Wednesday, my weekly live YouTube show about eyesight, vision, and most importantly, how you can improve it naturally. So if that interests you, make sure to subscribe to my channel. I go live here every week. And many weeks, like today, I have an amazing guest that I'm super excited about. And I'm going to bring her on stage, and I'm just going to say a few words about you, Dr. B. Dr. Amelia Barrett. Hi, welcome, first of all.
Hello. Thank you so much for having me today.
Thank you for being here. So you are, your specialty is migraines, headaches. You're Stanford-trained neurologist. And tell us a little bit, like, how did you end up doing what you're doing?
So as you mentioned, I'm trained in conventional medicine, spent many years doing that. But there was a moment for me about 10 years ago when it all changed. I had a patient who had severe migraines, and I just really liked this person. We really clicked. She had 4 kids. She had a job. She had a husband. Like, she had a life she wanted to get back to, and yet she was spending a day or two a week in bed. We went through all the meds. We did the acutes. We did the preventives. We did the supplements. We did the injections. We did the devices, and nothing was working for her. And this moment is imprinted in my brain. When I was handing her a prescription for another medication, back in the day when you handed people prescriptions, right? And I just knew deep in my heart that it wasn't going to fix her any better than the previous 10 medications we had tried. And I just, like, in that moment, it became crystal clear for me that I needed to help people in a different way. So that was really the turning point for me. After that, I got trained in functional medicine. I learned about biohacking devices that can help us track our body. I became a yoga and meditation teacher. And what I do now is I fuse all of those different tools together to give people an effective path forward that is based on truly finding and fixing the root causes of your headaches, not just silencing the headaches with a pill. It's based on true healing, true recovery. And so that is how I evolved into the work I do today. Honestly, it was the same thing that so many patients get frustrated with. They're frustrated that the only tool presented to them by conventional neurology is pills and devices. And, they want true healing as well. So that is what got me to where I am.
Well, thank you so much for that. And I definitely had headaches and migraines in my lives. And for a while, I was literally popping Excedrin, migraine tablets, like probably several times a week. Because if I didn't take them, it got so bad that, like you just described that patient, I just wasn't functioning. And I can talk a little bit later what I did, but I did address the root cause and it actually went away. But I'm also curious, like, what's the difference, between, because I didn't really know also, like, what is the difference between a headache, a migraine, and then also, since we're talking about vision here today, what is the visual migraine? Like, can you explain that a little bit for everybody?
Yeah, happy to. And I think the main distinguishing characteristics of migraines is that they tend to make you nauseated or not want to eat. They tend to make you sensitive to light, or at least you tend to put sunglasses on. You want to be in a dark room. They can make you sensitive to noises, or maybe you just tell your kids they need to be quiet. Like, it can be fairly subtle. And I think it's important to recognize that only 5% of people who actually have migraines have seen a doctor, been diagnosed with migraine, and been treated with medication. So there are an awful lot of people out there who think they just have sinus headaches or tension headaches or, headaches when they get stressed. And really, those people have migraines. Migraines also tend to be more one-sided, and they're much more likely to be associated with aura, which I think is what you're referring to when you say visual migraine, right? Is that what you're talking about?
Yeah, this is, like, honestly a question to you too, because, like I said, I never went to a doctor because I probably also didn't trust that they would give me anything useful. But I've had this several times in my life where, and I don't even know if this is the same thing, where I literally, first time I was skiing in Switzerland. It was super hot. It was like slushy snow. It was like I was really exerting myself. Like, my heart was racing. It was super hard. And then I got these kind of circles on the side, and they started on the side. Like I thought of the snake car in the Jungle Book, right? Like and it was covering my whole visual field and I couldn't see anything anymore. It was super stressful. Is that something that you would call a visual migraine?
It can be. So here's the key to figuring out if something is a visual migraine or an aura. So auras don't happen for everybody who has migraines. Auras can also happen and not be followed by a headache. The key thing about them is that you are seeing extra things in your vision on top of what's already there. So in your skiing in Switzerland, maybe you were by the Matterhorn at Zermatt, you're seeing all these beautiful places in the background, but you are seeing something on top of it, in front of it. It's there, even if you close one eye. And it's there if you close both eyes, you still see those same images.
Exactly. Yes.
Yeah. So that is what's key about an aura. And it is caused by a very well described phenomenon happening within the brain, a phenomenon of extra firing that often initiates the process of migraine. And so those visual symptoms can last anywhere between 15 minutes and an hour. I think a lot of people get confused about this because they may be having migraine related symptoms that last all day, but they're not truly aura. The aura is really just that visual phenomenon that's happening at the beginning of a headache. Now, sometimes, very rarely, people can have aura symptoms that are not visual. Maybe they have difficulty speaking, numbness or tingling. But again, that same criteria applies, that it doesn't last very long. If the symptoms do last longer than that, that's a different thing. Most worrisome, of course, is a stroke. And I can't tell you how many people I've taken care of who, suddenly have difficulty speaking and numbness and tingling on one side of their body, go to the emergency room because they think they may be having a stroke. And if that's the first time it's ever happened to you, yes, please go. But those symptoms can be from migraine aura as well. And it can be very difficult to figure it out if you're the person having this happen to you, because also your brain does not work all that well during a migraine.
Right. I definitely, the one when I had those kind of circles appearing, I had that maybe 2 or 3 more times in my life. I didn't actually get a headache. I didn't get any pain, but I've also had really painful where I had to lay down, like you said, in a dark room and nothing really was helping. So I'm curious, we talk a lot about side effects of medications, which we can also talk about, but does the migraines, since you're the, neurologist, like, does it affect your brain, like, negatively if you kind of, can it basically create damage in the brain if you have these migraines or headaches?
Unfortunately, yes, it can get bad enough that repeated migraines can cause physical changes in the structure of your brain. I personally find this to be one of the most alarming things that we've learned about migraines in the past decade, from all the fancy new ways we have to image the brain now, which we did not used to have. We used to tell people, when I started off my career as a neurologist, no, don't worry about it. It's just a migraine. It's going to go away. You just have to get through the pain. Here's a pill, we'll try to make you functional, yada, yada. That our understanding has completely changed. We now understand that a process called chronification happens to the brain. The brain fires differently again and again. And when the brain fires differently, it eventually starts to wire differently. So you get chemical changes in how the brain functions that can affect your mood, your memory. You get physical changes in the way the brain works. You can think of it as sort of like the brain becomes adapted to having headaches. So it gets really good at it, which is not what we want, but it's essentially the same process as learning to play a piano or something like that. When you do something over and over again, your brain catches on, it gets really good at it. So unfortunately, yes, you can have changes in the brain called chronification as a result of repeated migraines. And the net effect of those changes is that it makes it harder and harder for you to ever recover from headaches, because now your brain is adapted to it. It's primed to. So my message for people is, don't wait until it gets that bad, because migraine is still the #1 cause of disability in women under 50. It is a huge problem.
Really? Wow. I thought it was lower back pain, but that was probably all people. Wow. That is really, really crazy. And I'm curious about, my habit of just taking Excedrin because it was just like, my back pain, it's annoying, get that out of the way. Does that have, I mean, obviously we know that all these medications have side effects, but does that also kind of, I'm always think you said neurons that fire together, wire together. Does that basically train your brain to just get more headaches when you keep taking those pills? Okay. Wow.
Exactly. You're exactly right. That's what happens.
Okay.
Yeah.
Wow. But my mom always says, I never had a headache in my life. And I'm like, good for you. I know for myself, I like coffee. I've done many total withdrawing from coffee, sometimes for a year and had more energy. I just like coffee. And it's one of those morning ritual things. But when I don't, I just flew back from Germany yesterday to California. So I'm completely jet lagged. And, but when I don't have that cup, not today, but when I kind of get really off my schedule, or I take it 4 or 5 hours after I usually do it in the morning, some days, not always, I get these headaches from caffeine withdrawal. And at that point, the coffee doesn't, even if I drink one, then it doesn't do the job anymore. I don't know if you know what reason that could have, or.
Oh my gosh, you and I are totally the same. I have that exact same pattern with coffee. I love the way it tastes. I love something warm in the mornings. And if I don't have it, same deal. I will get a headache and coffee won't fix it at that point. I've got to do something else. Yeah, caffeine withdrawal is a known migraine trigger. So I think people with migraines have two choices. They can either drink the same amount every day, which is my solution, or you can give it up altogether and go with something that has less caffeine in it. Maybe, a cup of tea typically only has about 25 milligrams of caffeine, whereas a cup of coffee typically has 75 or 100. So it's a bigger shift in your system on those mornings when you don't get it. But the key is really consistency. If you just decide to have a little bit every day, then it's fine.
So I obviously do want to ask you about the root cause and how you approach that. But before we do that, a lot of times, with the clients I work with, eye strain is a huge problem, blurry vision. And then it's is it the horse or the cart, or the chicken on the egg? Is it the eye strain that comes first, creates the headaches, or is it the headaches? Because I always got really blurry vision when I had those really bad migraines. My vision was super blurry. I actually couldn't even have my eyes open. It was too painful. So what are your thoughts on that?
Yeah, that is a really good topic to talk about. So the way neurologists are trained to think of it is that eye strain is a cause of headaches of any sort. It doesn't have to be migraine, but that is actually pretty common and treatable cause of headaches for people. So we kind of tend to think of it that way, that it's a trigger. And I'm curious if you find that when you treat that eye strain, if you've had that experience with your clients, that their headaches tend to get better too.
Absolutely. Yeah. Even sleep. I mean, because it's all really based on relaxation. We do a lot of things with eyes closed and resting the eyes, and 100%. Yes.
Yeah. Yeah.
Okay.
Awesome.
So, I'm looking at YouTube. I don't see any questions yet, but let's talk a little bit about what can we actually do other than popping the pill, obviously, which we all know is not, to me, there is still sometimes I just don't have the ability. I just needed the pain gone, whatever. Let's say I'm speaking somewhere, or I just, but it should, for me, it's now the big exception, right? I don't even know whether I have to where did they even put these pills, right? Where do they even put them? Versus before I had them with me all the time, just in case. So what are other things that people can do? I know you talk about the root cause, or let's actually talk about what are the root causes other than eye strain, which we already identified.
Yeah. So I think the 4 big ones that most people don't know about, I'm going to focus on those because I feel like a lot of people understand, their own root causes, but I want to talk about the things that most people don't know they have. So one of those is nutrient deficiencies. We have learned in the past many years that the brain has different nutritional needs than other organs. And when you fix those nutrient deficiencies, headaches get better. Super cool information about that has been published in the past 2 years. Another very common cause of headaches is inflammation from leaky gut. And I would like to point out that a lot of people don't even know that they have leaky gut, because this happened to me. My functional medicine doctor diagnosed it. I was like, but I don't have any gut symptoms. And then she treated me. She tested me. My test was positive, treated me. It went away. And I was like, oh, I did have gut symptoms. I just didn't know that that was abnormal. I thought everybody had belly pain like every day or almost every day. Yeah, no, that's not the case. And now I don't anymore either. So yay. So that is a massively under-recognized cause of migraines. Toxins. I mean, there are 84,000 new toxins in our world since the start of the Industrial Revolution. 1% of them have been tested for safety. That's terrifying. And yes, our body has built-in capacity to handle toxins, but 1 in 5 people with migraines has genetic deficiencies in their ability to detoxify. It's called the GST gene, glutathione transferase, an important detox system in our body. So those are a particular issue for people with headaches, not being able to clear those toxins. And then another issue is that the very process of having headaches is stressful on your body, right? It makes you release cortisol. It increases your blood pressure. It increases your heart rate. It turns off your digestion. And this fight or flight state can shift our nervous system from a healthy balance over to a chronic fight or flight state. Even if we don't have a stressful life, the effect of the headaches is stressful on your body, right? And so for many people, they're living here without knowing it. And they need to help shifting back to here so that their body can start to heal again. So those, I think, are the 4 things that most people are not aware of that are common root causes that are contributing to headaches.
So just repeat. So it was the nutrient deficiencies in the brain. It was toxins.
Yeah.
But also, even if we do test them, I think we test them each separately, right? Versus all together. So toxic exposure beyond what our body can detox. Plus, I think I actually have that genetic modification, and that's one reason why I need to do those cleanses, those liver cleanses. And then you talk about
inflammation from leaky gut and chronic shifting of the nervous system.
Right.
Yeah, you got it. Those are the biggies.
Fatigue, right? Adrenal fatigue, just exhaustion, like chronic stress, which is also related to vision, right? Blurry vision is very much, and who doesn't, at some point, right, in this day and age, struggle with stress? I definitely do at times. And I can always tell that that's when the headaches come on, when my vision gets blurry and what am I doing?
We all have to endure it. We just need a bigger skill set to handle the demands of modern life than what our culture gives us. We have to learn concrete skills to handle that, which most of us we don't learn in the home. We don't learn them in school. We have to seek them out in order to function optimally.
So give us a few things, like when you work with somebody now, which is interesting that you also studied functional medicine. And I think this is so awesome. I really, Dr. B, I know you call yourself Dr. B. I know you as Amelia. But I think it's awesome that you have that background in traditional medicine, which to me is it's so valuable. Like, I'm not the kind of person who says only holistic approaches, because sometimes we do need Western medicine, right? So I love you look at it from like yin yang, right? You look at the whole picture. So if somebody comes to you, and I don't know if you only see patients one-on-one or what your model is, but how do you start diagnosing what the root causes are? How do you figure this out?
Yeah, so I primarily take care of people through online courses, which are available to people all over the world. And doing the lab testing is the first step. There are online labs where you can order labs without a doctor's order. And I so support this democratization of our health, of putting our own health in our hands. So a big part of what I do is, here are the labs you may want to consider. Here's what each of them is going to tell you. You order what you think is right, or you can have your doctor order it for you and run it through insurance. That's fine too. But I think the important thing is not just handing those over to somebody else and saying, okay, tell me what to do. You have to learn. All right, I know that this thing says that a B12 above 250 is normal, but I'm telling you, it's not optimal. That is not where you want to be. You want your B12 to be above 500. So you need that education that what I say is normal on the labs. That may be normal, sure, but do you want to be on the bell curve of normal American health? I don't think you do. I think you want to be optimal. Yeah, you want optimal health, especially if you're suffering from a brain symptom like migraines. So for me, the empowerment for my students comes from teaching them how to manage all this for themselves. They can check in with that periodically. They can say, okay, are my supplements working? They can say, all right, what do I need to change up this year? I'm just going to do a check-in this year. I want to know if I'm taking enough. So that is the first step, but I do it in a way that liberates people from the need for ongoing medical care or coaching about it. It's really about teaching people what they need to know to keep their own brains healthy. So,
that is so cool. I mean, like about 6 years ago, I took a program from a friend of ours and started measuring my blood sugar and being really strict about my postprandial blood sugar. And that's when my headaches completely stopped. And my blood
I love it.
dropped. And I was like, and I think a lot of times traditional medicine doesn't look at all these connections. I tell you a little story, like I'm really a little vulnerable here because for some reason, like recently I've had a little bit of edema, like my legs are swelling in the evening. And my mom noticed, well, your left one looks like, more like not really crazy, but enough to see it. So I thought like, okay, I have German insurance. I was in Germany. I went to the doctor. She said, go to a cardiologist. I'm like, why not? You know what? I'm over 60. Why not get the whole shebang, right? Like, at least I know. So they did the ultrasound. They did the EKG. What is it called? That when they did put the EKG, right?
EKG. Mm-hmm. Yep.
Say it in German better. And they did the one where you bicycle like crazy and they measure your blood pressure and all this. And they even checked my arteries and veins here in the neck to see if there's any, clogging. Nothing. It's all good. And he said, you know what? No, worry about it. It's all good. I'm like, no, my feet are swollen in the evening. This is new. Why is this happening? There's something going on. And so this is like the frustrating part to me that a lot of times, they just say, it's good. It's okay. Unless, emergency, right? Stroke or heart attack, it's like just cruising along. And they look at the labs, like you said. So do you advise people like when they get the labs, because this is where I know quite a lot, but still I get my lab results and then I don't really know like what to change for everything, right? Like, let's say, cholesterol is too high, whatever. I'm just making something up. Like, how do you guide people in your program, your students, to like what actions to take based on their labs? Or
Yep, absolutely. It's all pre-recorded. They learn how to manage it on their own. And if your level's here to here, here's what you need. If your level's here to here, here's what you need. If you have this plus this, then you need that. If you have this over here, girl, you need to start exercising every day or whatever,
Right. So are there any common things that you find a lot of people have? Like you talked about the deficiencies. I'm curious about that. Like, are there any common nutrient deficiencies that people have that you find over and over again?
Yes, the one that is most important to me for everybody to know about is a deficiency of intracellular magnesium. Okay, so in conventional medicine, we typically measure the amount of magnesium in the bloodstream. That is about 1% of your total magnesium supply. Your body will do anything to keep that magnesium number normal, including pull it out of your bones. Okay, not what we want. We want our stores to be optimal. We do not want our body to be stressed and on the low side. So how do you figure that out? You have to check magnesium a different way. So we check the amount of magnesium inside your red blood cells, and that gives you a much better picture of what your chronic stores of magnesium are. Of all the supplement studies that have been done, and believe me, guys, there are thousands of supplements that have been studied for headaches, the data is the best for repleting magnesium. Now, obviously, still some people get better with it, some people don't. Well, if you want to know if you are one of the people who needs to take magnesium, because it's big doses and it's every day, it's an investment of your time and money, get your red blood cell magnesium checked, and that will tell you. It needs to be above 6 for most labs. That may vary from lab to lab, but in the one I use, It needs to be above 6 in order to have optimal stores. If you get below that, then that is a fixable problem that is contributing to your headaches.
And what is the test called? I don't think I've done so many tests. I order them online, like just like you said. Or I forced my doctor in Germany. I'm like, order those tests, and then she's like, "Why?" I'm like, "Just do that," and she does.
Yeah. So it's called an RBC magnesium, red blood cell magnesium. It is covered by LabCorp. It's covered by Quest. I order it in my patients who I see in my office. It's cheap. And it is one of the most important pieces of information you can get about your body that influences your headaches.
So what about, like, I know this is always a dicey subject, but what about diet? Obviously, we know sleep is probably very important, but what about diet other than, and maybe was there other supplements you wanted to talk about, or was magnesium kind of the main thing that people don't talk about?
There are about 24 things that I recommend people take a peek at. So we're not going to have a time to go over it all today, but I want to make sure that people know that one thing, because most doctors do not check it in the way that's going to give you the information they need. Even if they do check it, they may not interpret it in the way that is most helpful for you as somebody with headaches. So, so I think if for the sake of time, we probably can't do them all.
I know, but I'm curious about diet, because for me, like I said, the blood sugar regulating, I pricked my finger a bazillion times, and I got one of the, continuous blood glucose monitors. That was like, and at the same time, I also didn't drink any alcohol and didn't drink any coffee. So, sometimes it's hard to tell, but I know recently I haven't been as good, stress, family, whatever, other things that happen sometimes in life. And I noticed that my headaches, not crazy, but I noticed that I was like, okay, wait a moment. Do I even have some headache pills still, So I can tell when I'm not really clean with everything I do, which a lot of people, like, you might get the same thing. Like, why do you have to be so strict? Just treat yourself once in a while. Like, I hear that all the time. And I do. And then every time I get the belly aches and the headaches and, you know what I mean? So are there any things that you say that should be a no-go when it comes to diet, and things that people should definitely include in their diet?
I think ideally people should personalize this through food sensitivity testing, assessing your risk of celiac, checking for that if it needs to be done. I'm sure you've probably seen this too. So many people get better when they stop eating common food allergens, and they didn't realize how much it was impacting their health until they stopped. So this was totally the case for me. So my daughter was diagnosed with celiac when she was 4 years old. So there was a period when I was adjusting where I would make like the gluten-free pasta and then the regular pasta for the rest of the family. This did not last long, I'm telling you. I have 3 kids, I'm a doctor, like the 2-dinner thing, that did not last long. But there was a period of time where I was still eating gluten, thinking, well, I don't have any problem with it. It's her. I got tested for celiac, I'm fine. Obviously, when your kid gets diagnosed, you get tested too. Well, I don't have it, I don't have to do that. But what happened for me is when I eventually just was like, okay, I can't handle 2 different lives. Like, it has to all be gluten-free. And so when I finally made that switch, both at home and outside the home, even when I was at work, even when I was out with friends, situations where I could have eaten gluten if I wanted to, because I wasn't cooking for my daughter. But when I just went all in with it, I suddenly discovered that my joint pain got better. I had what I thought was arthritis in my hands. I just turned 55. I'm like, it's arthritis. I'm getting old. Right. That's just what it is. Yeah, my arthritis went away. Yeah.
I have the exact same thing every time I eat gluten. And
oh my gosh.
I haven't eaten it in like 4 years. And then this time in Germany, I don't know, like I just caved in. But I didn't have any issues. And I think the wheat in Europe is also very different than in the US. But I'm not an expert on this. And I also haven't done extensive testing. But usually when I eat gluten here, which I haven't done again in years, I would always get immediate belly aches, joint pain. Like I said, that my fingers get stiff. I can't even bend them properly. So, well, this was super interesting. Are there anything that you want to share to just say final closing? Oh, actually, before we do that, where can people find you? How can people connect with you?
I think that if you're interested in this idea of finding and fixing the root causes of your headaches, the best place to start is at migraineclass.com. I recorded a short 10-minute video that explains in a little bit more detail how all of this works. And there are ways for you to connect to additional resources, whether you want free resources, group programs, one-on-one work, whatever you need in your particular situation, there's something there for you.
So migraineheadaches.com. I think we have another website.
It's actually migraineclass.com.
Oh, Migraine Class. Okay.
Yep.
Got it. Because I think we have another website for you as well. And there's a quiz that you have, if I'm not.
Yeah, there's a quiz that you can take as well. When I was talking about chronification earlier today, it's not a new concept for us neurologists, but most patients haven't heard of it yet. So I put together a quiz so that you can find out if you are in chronification or not. And if you are, what you need to do. If you're not, what you need to do, because it's it's night and day, right? And so I can at least get you started on what you can do to help in your particular situation. So if you want to figure that out, that is at theheadachequiz.com.
Awesome. I'm posting that onto the YouTube as well.
Thank you.
With the Migraine Class. Yeah. We don't have any questions on YouTube today. You never know. This was super interesting. I learned a whole lot, and my Clear Vision Club members can have a little bit extra time with you before you have to hop off. So thank you so much, Dr. B, and for sharing your time. And I know you just had a bronchitis, so I'm so grateful.
Sorry, guys. Yeah.
This was super interesting. Thank you so much for joining me today and sharing a little light on migraines, headaches, vision, how that's connected to vision, and what the root causes are. Really appreciative.
Thank you.